Hello! Today, we are going to learn about the vitamins. But first, what is vitamins? Vitamins are organic compounds essential in small amounts for the proper functioning of the human body that must be obtained from dietary sources because the body cannot synthesize it.
Hello and welcome. I am Reimare Icy Fiel from BSN1 Section A4 and I am the leader of Group 5, and today I will be discussing to you about vitamin C. First off, vitamin C is a water-soluble vitamin. It means that vitamin C is a vitamin that must be constantly replenished in the body because the body constantly or rapidly eliminates it through urine. It means that vitamin C is a vitamin carried in the bloodstream and are needed in frequent small doses and are unlikely to be toxic except when taken in unusually large doses. The role it plays in the body is that vitamin C, or also known as ascorbic acid and civitamic acid, has several important functions. These include number 1, helping to protect cells and keeping them healthy. Number 2, maintaining healthy skin. Number 3, blood vessels and for healing wounds and form scar tissue. Number 4, repairing. Number 5, maintenance of bones, cartilage, teeth. And number 6, aiding in absorption of iron. Next would be vitamin C can be naturally found in foods such as fruits and vegetables, fruits especially citrus, vegetables in the cabbage family, and cantaloupe, strawberries, peppers, tomatoes, potatoes, lettuce, papayas, mangoes, and kiwi fruit. Vitamin C deficiency can most likely occur if a person has poor diet. The most commonly found disease due to the severe lack of vitamin C includes number 1, scurvy. This causes bruising easily, bleeding gums, and tendency for bones to fracture. Number 2, fatigue and joint pain. Number 3, weight loss. Number 4, slow healing of wounds and fractured bones. Number 5, hair loss. Scurvy in infants is rare because breast milk is usually supplies enough vitamin C for them, and infant formulas are fortified with this kind of vitamin. Scurvy is rare but may occur in alcoholics, smokers, and older people who are malnourished and those with kidney disease who get dialysis. A person will need an extra 35 milligrams of vitamin C per day to help repair the damage caused by free radicals that form when smoking and drinking. So that's all, and thank you. And always remember, if you are scared of hair loss, eat orange. That's all.
Life should taste as good as vitamin B12. Good day everyone, I am Laurence Canillo and I am here to discuss about vitamin B12. Vitamin B12 is an essential micronutrient that belongs to a group of water-soluble vitamins. It is also known as cobalamin and plays a considerable role in the cellular metabolism of the human body. Vitamin B12 is the largest and most structurally complicated vitamin. It occurs naturally in meat products and can only be industrially produced through bacterial fermentation synthesis. Vitamin B12 has many roles in your body. Thus, it is a nutrient that helps keep your body's blood and nerve cells healthy and helps make DNA, the genetic material in all of your cells. Vitamin B12 also helps prevent megaloblastic anemia, a blood condition that makes people tired and weak. Vitamin B12 can be found naturally in animal products such as fish, meat, eggs, and dairy products. Clams and beef liver are some of the best sources of vitamin B12. Some breakfast cereals, nutritional yeast, and other food products are fortified with vitamin B12. A lack of vitamin B12 or lack of folate causes a type of anemia called megaloblastic anemia. With these types of anemia, the red blood cells don't develop normally. Moreover, vitamin B12 deficiency occurs when the body does not receive enough vitamin B12. It can result in irreversible and potentially severe damage, especially to the nervous system and brain. Here are some symptoms of a vitamin B12 deficiency. First on the list, we have pale or jaundiced skin. People with a B12 deficiency often look pale or have a slight yellow tinge to the skin and whites of the eyes, a condition known as jaundice. This happens when a lack of B12 causes problems with your body's red blood cell production. Second, weakness and fatigue. Weakness and fatigue are common symptoms of vitamin B12 deficiency. They occur because your body doesn't have enough vitamin B12 to make red blood cells, which transport oxygen throughout your body. As a result, you are unable to efficiently transport oxygen to your body cells, making you feel tired and weak. Lastly, disturbed vision. One symptom of vitamin B12 deficiency is blurred or disturbed vision. This can occur when an untreated B12 deficiency results in nervous system damage to the optic nerve that leads to your eyes. The damage can disrupt the nervous signal that travels from your eye to your brain, impairing your vision. This condition is known as optic neuropathy. Who is most at risk? People with megaloblastic anemia may lack vitamin B12. Megaloblastic anemia is an autoimmune disease that affects the blood. Patients with this disorder do not have enough intrinsic factor, a protein in the stomach that allows the body to absorb vitamin B12. Those at risk of vitamin B12 deficiency includes older adults, people with gastrointestinal disorders such as Crohn's disease or celiac disease, those who have had gastrointestinal surgeries such as bariatric surgery or bowel resection surgery, people on a strict vegan diet, those who take metformin for blood sugar control, those taking proton pump inhibitors for chronic heartburn. To sum it up, vitamin B12 is a water-soluble vitamin that you must obtain through diet or supplements. It is responsible for many bodily functions and may benefit your health in various ways, such as by preventing major birth defects, supporting bone health, improving mood and maintaining healthy skin and hair. Getting enough vitamin B12 through your diet is crucial. However, if you struggle to obtain enough or have a condition that affects absorption, supplements are a simple way to increase your B12 intake. That would be all. Thank you.
I'm Trexie Mae Marciano and I'll be going to discuss vitamin E. Vitamin E, also known as tocopherol or alpha-tocopherol. It is fat-soluble, which means it absorbs and similarly moves through the body to fats. It's stored in the liver and fatty tissue and is used when needed. Functions of vitamin E. Vitamin E is a nutrient that's important to vision, reproduction, and the health of your blood, brain, and skin. Vitamin E also has antioxidant properties. This means it protects body tissue from damage caused by free radicals. Free radicals can harm cells, tissues, and organs. They are believed to play a role in certain conditions related to aging. It helps form red blood cells and widens blood vessels to keep blood from clotting inside them. Cells also use vitamin E to interact with each other, and it helps them carry out many important functions. Food sources of vitamin E. The best way to get daily requirement of vitamin E is by eating food sources. Vitamin E is found in the following foods. Vegetable oils, such as wheat germ, sunflower, safflower, corn, and soybean oils. Nuts, such as almonds, peanuts, and hazelnuts or filberts. Seeds, such as sunflower seeds. Green leafy vegetables, such as spinach and broccoli. Fortified breakfast cereals. Deficiency symptoms and diseases of vitamin E. Because vitamin E is found in a variety of foods and supplements, vitamin E deficiency is very rare in healthy people. It is almost always linked to certain diseases in which fat is not properly digested or absorbed. Examples are pancreatitis, cystic fibrosis, and celiac disease can develop a vitamin E deficiency. The following are common signs of a deficiency. Retinopathy, damage to the retina of the eyes that can impair vision. Peripheral neuropathy, damage to the peripheral nerves, usually in the hands or feet, causing weakness or pain. Damage to the immune system. And in some cases, vitamin E deficiency results from a rare genetic condition known as ataxia. This condition is neurologically based and affects muscle control and coordination. Who is most at risk for deficiency of vitamin E? It's most likely to develop in children between the ages of 5 and 15. Deficiency is also common in newborns and babies born prematurely who have lower birth weights and less fat. Premature infants are at risk because an immature digestive tract can interfere with fat and vitamin E absorption. Vitamin E deficiencies in these infants can also lead to hemolytic anemia, which destroys red blood cells. In addition, vitamin E is an anti-sterility vitamin and is the least toxic among fat-soluble vitamins. Slogan: Desire the beauty and experience immunity with vitamin E.
Hello, today's talk is about vitamin B5, or also known as pantothenic acid or pantothenate. This vitamin is water-soluble, which means that vitamin is carried to the body's tissues but is not stored in the body. Also, the word pantothenic comes from the Greek word pantho, meaning everywhere. Because nearly all food contains small quantities of pantothenic acid, as with all B vitamins, pantothenic acid helps the body break down fats, carbohydrates, and proteins so that our body can use them for energy and rebuilding tissues, muscles, and organs. B5 vitamin also helps with the proper functioning of the nervous system and liver, making sex and stress-related hormones in the adrenal glands, and makes red blood cells which carry oxygen throughout the body. So, as I've said before, all foods and vegetables contain vitamin B5, like meat, mushrooms, nuts, beans, and whole grains.
My name is Aurizejan Toni and Tulod, and I am tasked to report about the manganese. Manganese is a trace mineral. It is essential for human health, however, only in a small amount are required. Manganese is involved in a variety of human functions including amino acid, cholesterol, glucose, and carbohydrate metabolism. It also aids in bone development, blood coagulation, and inflammation reduction. Functions and importance of manganese in our body. Manganese is necessary for the formation of connective tissues, bones, blood clotting factors, and sex hormones in our body. It also aids fat and carbohydrate metabolism, calcium absorption, and blood sugar control. Manganese is also required for proper nerve and brain functions. Food sources in manganese can be found in a range of food including whole grains, plums, oysters, mussels, almonds, soybeans, and other ligaments, rice, green vegetables, coffee, tea, and a variety of spices like black pepper. Disease in manganese deficiency may induce bone demineralization and poor growth in children, skin rashes, hair depigmentation, lower serum cholesterol, and increase in alkaline phosphatase activities in male, and changed mood in the increase of premenstrual pain in women. And here's my slogan.
Hello everyone, this is Angel Rose Albano, and today I'm going to be talking about the mineral iron. So iron is a micronutrient, which means that it is a nutrient that our body needs in smaller amounts. So I have here 3 functions of iron in our body. 1. Iron helps oxygenate the blood. Key function of iron is to facilitate oxygen transport by hemoglobin, the oxygen-carrying pigment of the erythrocyte red blood cell. It is also involved in oxygen storage by myoglobin, an iron-containing protein that transports and stores oxygen within muscles and releases it to meet the increased metabolic demand during muscle contraction. When we are low in iron, it can make us feel sluggish, irritable, and unfocused. Second, iron helps convert blood sugar to energy. Our bodies need iron to convert blood sugar to energy. It helps boost hemoglobin production and thus increases the transport of oxygen to help elevate fatigue and tiredness. Also, the creation of enzyme depends on iron. Whether you're an Olympic athlete or a regular person with a 9-to-5 desk job, your body needs iron to perform at its physical and mental best. Third, iron boosts the immune system. Iron is vital for the proliferation of all the cells, including those of the immune system. Having an adequate amount of iron in your system will help your immune system to function and help you support and maintain good health. So these are not the only functions of iron, but there are so much more. But you can further look into it in books or the internet or anywhere that it is reliable. So where are the good dietary source of iron? So we have red meat, liver, and egg yolk, and etc. like beans and nuts. So these are the deficiencies, symptoms, and diseases in iron if we have so much or less. When the body supply of available iron is too low, the condition is known as iron deficiency. People with iron deficiency cannot produce an adequate amount of hemoglobin to meet their body's oxygen transport needs. When the deficiency becomes severe, such as there are too few circulating red blood cell or hemoglobin content and the cell is very low, the condition is diagnosed as iron deficiency anemia. The most common symptoms of iron deficiency anemia are tiredness, weakness due to the inadequate oxygen supply up to the body cell, and paleness in hands and eyelids due to the decreased level of oxygenated hemoglobin, which is red in color. Iron deficiency anemia can be treated with iron supplements. It is also possible to have too much iron deposited in the body's tissue. This condition is known as iron overload. If the iron overload becomes severe, the condition is diagnosed as hemochromatosis. Hemochromatosis can result serious damage to the body's tissue, including cirrhosis of the liver, heart failure, diabetes, abdominal pain, and arthritis. A recessive genetic mutation can put some people, particularly those in Irish and Celtic descent, at a higher risk of the development of hemochromatosis. Treatment for the condition consists of removing blood from the patient to decrease the iron in the body. So who's more at risk with iron deficiency? The highest probability of suffering iron deficiency is found in those parts of population that have inadequate access to food rich in absorbable iron during the stages of high iron demand. This group corresponds to children, adolescent, and women of reproductive age, and particularly pregnancy. So in case of infants and adolescent, the increase of iron demand is a result of rapid growth. And for women of reproductive age, the principal reason for excessive blood loss is during menstruation. During pregnancy, there is a significant increase of iron requirement due to the rapid growth of placenta and their fetus and the expansion of the globular mass. In contrast, adult men and postmenopausal women are at low risk of iron deficiency, and the amount of iron in a normal diet is usually sufficient to cover their physiological requirements. So I have here the slogan, iron deficient, anemia is near. To wrap it all up, because iron plays such a crucial role in our body, it is important for us to maintain an adequate supply of iron. Our bodies continually lose iron throughout every day process such as urination, defecation, sweating, and sloughing of our skin cells. Bleeding contributes to further loss of iron in our body. To compensate, we must maintain an adequate amount through consumption. And remember, be healthy, eat healthy.